This is a roundworm called TOXOCARA. In dogs, it's called TOXOCARA canis. In cats, it's called TOXOCARA cati. In dogs, these worms mostly affect puppies. Yes, and puppies get infected through the placenta of their mother. So the eggs of this worm can pass through the placental barrier into the fetus, and when the puppies are born, they are born with these worms, or with the eggs of these worms. And another way puppies can get infected is through the milk of the mother. So nursing mothers can infect their puppies through the milk. Puppies can get infected by picking up contaminated eggs in the feces of the environment, or on the paws. When they lick their paws, the eggs that are attached to the paws of the dog, they can lick it and get infected. So these eggs in the puppies move to the small intestine, where they hatch and become adults, and then the adults will lay egg and they are passed out through the feces in the environment. So this is one way puppies get infected. So how will you know if your puppy is already infected? Adult dogs, most times they won't show any clinical sign. It's only puppies that will start showing clinical signs, such as pot belly, or swollen abdomen. You see the dog, sometimes the dogs will be vomiting, will have diarrhea, rough hair coat. The dogs will not be growing well, despite the fact that they are eating. They will be weak, and then they won't have appetite to eat. So when you start seeing some of these things, sometimes you can even see visible adult worms in their vomit or in their feces. When you start seeing all these things in your puppies, you know that your puppies are already infected. Heavy infection in puppies is fatal. Do you know why you should care about this parasitic infection? Because children are mostly affected. Why are children affected? Is because children and puppies, they're friends. So it's easy for children to get infected when they play with the puppy. They won't wash their hand. They might put their hand in their mouth and ingest the eggs of this toxocara. And when they ingest these eggs, the eggs in humans don't mature into the adult. They will just remain at the larval stage, which is the infective stage, the L3 stage. So these worms in human migrate through the visceral organs, can migrate through the lungs, the heart, the spleen, the kidneys, even the brain. And when they migrate, they cause damage to those organs that they move to. And this is called visceral larval migrants. Also, they can even move to the eye, called ocular larval migrants. And when they move to the eye, they can cause partial or even total blindness. How is this condition diagnosed? The condition can be diagnosed through the what we call fecal examination, whereby the feces of puppies or the feces of dogs is being examined microscopically for the eggs of these parasites. This condition is called toxocariasis, and the treatment of this condition is by deworming the mother, deworming the puppies. Also, we can also treat symptomatically. For instance, if the dog is vomiting, you tackle it. If the dog is having diarrhea, you tackle it. If the dog is not eating, you tackle it. So by that, you are treating the puppy. Now, for the prevention, routine deworming of the mother and the puppies. Remove the dog feces immediately they defecate. You pick up the feces and throw them away. Also, when after handling dogs, whether the mother or the puppies, you wash your hands. Prevent children from playing in contaminated areas. Anywhere dogs have defecated, don't allow children to play there because they can get infected. You never know which dog is already infected with this Toxocara. Yeah, they are just the ways to prevent it because they say prevention is way cheaper than cure, and that's true.